Good evening, everyone. My name is Dr. Funmi Aina, and I'm privileged to be the one anchoring tonight's Wellness Wednesday. This is the third Wednesday of the month, and what we have today is question and answer. You know, over the months, over the years, over the weeks, people have asked different questions, and these have been put together. And today we're going to be answering some of them. And I am not alone here today. I'm privileged to anchor, but we have a medical team that is going to be on the panel tonight to answer most, if not all, your questions, all the questions that have come in that we have with us. And I know some of us will be answering, asking questions as well. I see somebody's hand up. Okay. So with me tonight on the panel are the following members of the medical team. We have Dr. Patricia Olushayo Ogumola. Dr. Ogumola is a nurse midwife, and she also has a PhD in health education. I think I'm right. So let's welcome Dr. Patricia Olushayo Ogumola. Then we have all the way from St. Kitts and Nevis in the Caribbean, we have Dr. Uche. Dr. Uche, you're welcome. You're very welcome. Great to have you here. And last but not the least, we have our very own Temitope Akinyemi, aka MI, who is a pharmacist. And so it's great to have a varied group of medical personnel. And so we're in for a great time where we're in for, you know, our questions being answered. And so I welcome you all today. So what we're going to do is you're welcome.
Good evening, everyone.
Thank you so much for being here. I've made some people co-hosts. Please, can you help to admit people as we move along? So we have a number of questions here, and our panel are going to be doing justice to them. And some of us here may also have one or two burning questions. If you do, please put them in the chat box, and we shall have a look at them as well as time permits. So, and anyone can go for it. Anyone who answers, if the other person if somebody else would like to contribute to it, let's go for it. So the first question I have here is, what reader product can someone with serious body odor use?
Okay, let me just attempt to start. I know that my other members of the panel will also take a stab at it. Good evening, everyone. Good evening, Dr. Aina. Good evening, Dr. Ogumola. Good evening, Dr. Uche. Good evening, everyone. It's my pleasure to be here. Always a pleasure to add value and, you know, to be a part of people's journey to well-being overall. Okay, so to the first question, you know, this question is a little bit, I mean, for someone to ask this question means that they've tried all sorts. That is my assumption. I mean, my assumption is that, you know, they've tried the basic things of ensuring that hygiene is okay, you know, and all of that is in place. Although we are taught not to assume. So by saying that I assume is also saying I hope the basic things are in place to ensure that, you know, the reasons for body odor is taken care of from a hygiene point of view. Interestingly, I've had a testimony with a similar product dealing with body odor. I've actually, I mean, that was the first time I I had something, you know.
Where are you going to? You want
something? Of course, I understand the fact that the skin of our bodies are, you know, there's osmosis, so there's what goes in, what comes out. So, and that's why when you take garlic or when you take some things and you sweat or you pee, or when you take antibiotics and then you pee, you know, you smell, the smell is, I mean, is undeniable. So is, you know, there's something going on definitely in the body of that person that is probably internal, and is, the person would need some cleaning internally, which of course our go-to will be the bitters. When we talk about oxidative stress and the need to detoxify, it's possible that there's stuff going on, even as basic or as major as GIT, you know, and all around. GIT is a gastrointestinal, that's the digestive system. So that I just want to be as speak basic English. So there may be a need for the person to go on a detox journey, apart from checking the diet and whatever the person else is taking in. Definitely the bitters, I know would be a very, very highly recommended one to go in that direction. And also, in case there's a possibility of infection and stuff like that, the person can also add the cleanser and use it over a period of time without breaking it. I would recommend, I mean, at the very least, do a 30-day non-stop and see how it goes. But really, really plan to do it over a 90-day period. So I would say the bitters and the cleanser, while ensuring that all the basic things are in place, you know, because what is happening inside really does gets to the outside, and that's why people will perceive. Yeah. So.
Thank you very much, MI. Thank you. Just to add, I mean, just like you said, just like MI said, it may be assumed that the person has done the needful, and even that needful includes having a medical checkup, because there are some health conditions that can also give one form of odor or the other. Some metabolic conditions like diabetic ketoacidosis, which is a complication of diabetes. So I would like to assume or encourage that the person has also had a general medical checkup to make sure there's no underlying illness that could have been complicated leading to the body odor. So thank you very much. I don't know if any of the other panelists would like to contribute to that.
Good evening, Dr. Aino.
Good evening.
Everyone, good evening. It's nice being here once again. Emma talked about the personal hygiene aspect, but I think the person can also make use of the body wash and disinfectants while having his or her bath. And that also will go a long way in eliminating the body odor, as well as taking the reader bitters and cleanser along so that everything will work perfectly well. That's my own contribution to
Thank you. Yeah, thank you very much for that. Yes, and you know, we have solution packs that contain all those products, and that would definitely help. So we come to our next question. Our next question is, what can a 7-year-old girl with itchy vagina and pains after urinating use? So who would like to go for that?
Let me go for that. A 7-year-old girl. Well, in my years of practice, I've had instances of girls of 5 years, 6 years, 7 years, even 4 years that are female complaining, I mean, the mothers or the child complaining of itching vagina. There are a lot of things. There are a lot of factors that can cause itching vagina. But most of the time is the personal hygiene that tends to stand out most of the causes of vaginal itching amidst these children. You see some of the mothers who complain that they found out that the girl tends to use their fingers to touch their vagina. If the mother will take time to check that vagina, they find out that there are secretions that are already sticky. So it tends more to be the aspect of personal hygiene. If that aspect is now ruled out and the child is still having itching, then there's need for a checkup or for some tests to know what is really wrong. But that personal hygiene aspect is very, very important because when they go to toilet, the way they clean themselves up and the likes goes a long way in knowing what is causing the vaginal itching. But in case, the product I can recommend for such a child is just the Reader Bitters because of the age. But in case there are health issues identified along with vaginal itching, and if the child is having itching and is scratching the place, by the time the child will eat, there will be pain because the place is already scratched and there are bruises. So the itching and at the same time urinating can bring about pains for the girl. So Reader Bitters can be of help. And during that time, the disinfectant can be of great help too. Anytime the child goes to toilet, it is put inside water to clean up. And as time goes on, this will go a long way in helping that child of 7 years. Thank you, Ma.
Thank you very much, Dr. Olushayo. Does anybody else, or would anybody else like to contribute to this?
Okay,
Dr. Uche, I saw you.
Add something.
Okay.
This one is not particular. I mean, Dr. Ogumola already I think she did justice to that. I know the times that we're in, right? You can't really rule anything out. So I'm not bringing my medical cap in here. I'm bringing my mother cap in here. And I want to just use this medium to educate mothers, right? When young, especially children that are really young, when they make such complaints sometimes about vaginal itching, burning sensation, sometimes in some occasions, it may not necessarily be hygiene and all of that. Who knows? God forbid, right? But, cases of abuse are not too far. They're not too far away from us. So just something I just wanted to add is to engage the child, right? Ask questions, make the child feel comfortable, let the child open up and, just share about what's going on down there, or maybe, I know that then, although maybe now schools are now tuition and all of that, then we used to have funny chairs we sat on in school, some nails will be sticking out, and different things. You never just know. But I mean, I don't know the times that we're in now, and as far as that's concerned, I just wanted to add the bit that, it's good to engage the child, speak with the child, and take the child for proper examination so that the place is checked, and then one can just do the needful. Yeah, that's just in addition to the hygiene bits. Thank you.
Thank you very much, Emma. Actually, it is your medical cap because non-accidental injury in pediatrics and child health is there's usually a very high index of suspicion when there is any funny thing. So in fact, that for probably if the child was taken to a pediatrician, that would be the first first thing that they would want to rule out. So thank you very much. Did Dr. Uche want to say something?
Yes, they've actually done justice to the case at hand. Additionally, the underwears of the little girl should also be checked. These days we have most mothers busy with work and all that, and not having that time to bathe the kids. A 7-year-old child, yes, is old enough to bathe herself, but once in a while, you can also help bathe them and make sure that the area is well cleaned. And then their undies, make sure it is washed, it is clean, and they're using appropriate undies, which is cotton. Yeah, it helps because if they wear all those, like the nylon, it makes them sweat. And because they still run around at that age, they might still put it back in their normal clothing and wear it again without their mothers even knowing. So those little things actually make sense, they count.
Okay, thank you very much, Dr. Uche. So we have a question in the chat box, which I'm going to read out, and anyone can take that. And if anybody has any questions, please drop them in the chat box so that we go, according to how we see them there. So this question says, please, there is an 11-year-old girl. She is so fat and affecting her breathing. What do we give her? Yeah, that's the question. Anyone can go for that.
Can you repeat the question, please?
Yes, it says, please, there is an 11-year-old girl. She is so fat and affecting her breathing. I want to believe they're saying her weight is affecting her breathing. What do we give her?
11 years old.
Hearing anything you are discussing,
I'm sorry, sir. We can't hear you. I see your hand is up. Perhaps you can drop your question in the chat box so that we can attend to it. Thank you. Yeah. So who would like to go for that?
Right, let me go for that. For the 11-year-old child, I would say lifestyle changes, diet. The diet of the child should be looked into, and that would have to change completely. That would affect diet of the whole family. So diet has to be checked. I'm not going to say sedentary lifestyle, because at that age, the child is still going to be running around, not necessarily going to the gym, but they will still be running, playing around. So that is a form of exercise. So I think the bulk culprit here is diet. So diet, then we can add bitters from our products, but the most important thing here will be diet. So diet should be changed.
Thank you very much, Dr. Uche. I think, definitely one of my professors used to say something. He used to say, whatever is the father of obesity, food is the mother. So although there are, again, some metabolic conditions that endocrine metabolic conditions that cause excessive weight gain, and it would be important to rule that out, not just feel that the child is fat. Take her to see a doctor, let her be assessed, because there might be there might be an underlying health condition that is making it that way. So thank you. Emma, would you like to say something?
Yeah, I just wanted to add something. I was saying earlier, that the times when we grew up is different from the times that we have now. These days, children, it takes a lot, right, for children to even run around. They don't run around now like we used to run around. Now you have video games, you have phones, you have YouTube, so children actually really do have a sedentary lifestyle, Dr. Uche. You understand what I'm saying? Yeah. So I mean, just in addition to that, I mean, we want to encourage that child to become a bit more active, to embrace the lifestyle of being, because I mean, even if one does a crash now, whatever one does now, it crashes. If it doesn't impact on the lifestyle, and then it will just be a cycle. It crashes, it piles up again because there's no system to keep it in check, that kind of thing. I just wanted to add that. I mean, that's important. He's already having problem with breathing. You may want to introduce walking, cycling, teaching the child to swim, things that is necessary. The energy is there now. There's time. This is the time. So I just wanted to add that.
Yes, thank you very much. Yes, something to burn the energy, burn the calories. So thank you all for that. Now, our next question here, it says, what can be recommended for a patient with PCOS? And PCOS is polycystic ovary syndrome. So who would like to go for that?
Well, let me go. I think I'll be added to it. When we talk about polycystic ovarian syndrome, we are talking of more hormonal problems somewhere. And the product that is available, we have a solution pack like for female wellness. When we talk about PCO health, it tends more towards the wellness of a woman or of a female. And most of the time, people with that condition find it difficult in conceiving or getting pregnant. And the solution pack that can go for that one is the one that contains the Restore. That's our main product that is for the female, that works on the hormonal cycle, that corrects a lot of things that has to do with the woman. So, and it's when you look at the solution pack, we have cleanser there, we have the bitters, and if the person can actually use it for that 90 days, then that condition or that issue can be corrected while using the solution pack. So the solution pack for female wellness, that is for the female, we have the one for the male. Well, yeah, for the female, for the fertility pack can go and can be helpful or help in solving the PCO health problem.
Okay, thank you very much. Would anybody like to add to that? Okay. Now we have another question here. Thank you very much, Dr. Ogumola. The first one here, it says, a friend of mine lost her only child and been looking for another. So far, medical investigation show that she and her husband are fine, but no sign. So yeah, over to the panel. Who would like to contribute to that conversation?
Yeah, I guess that's like secondary infertility.
Yeah.
Of some sort. Yeah, and if they've been checked medically and they have both been certified okay, it's not bad to have a second opinion as well. As far as the tests are concerned, it's not bad. It's not a bad idea. And once they have ascertained that they're both fit to medically fit to have children, then they can try the female fertility pack. That's the solution pack for female, and then the male wellness pack for males. That's highly recommended. And one thing I would like to say, especially about the female fertility, female wellness pack, is the fact that especially the restore part of it, what it actually does. I mean, sometimes we don't know the changes that happen in the female body after giving birth to one child. I spoke with a lady, sorry to digress, I spoke with a lady during the weekend, and by the time she spoke to me and what happened to her body after she gave birth, I mean, I was just thinking that God, I mean, there's a lot that happens in the body. Some are very obvious, some are not obvious. Some people recover, some may linger for a long time and all of that. And what Restore actually does is that, as the name suggests, the work is to help the body to be restored back to a state where the environment of the female is conducive for implantation and for implantation to happen. That means to get pregnant. So sometimes it's apparent. You check and then you see, oh, there's hormonal this here and there. Sometimes it's not apparent, and that's why I would recommend more often than not, it's even when you don't want to give birth. I don't want to give birth anymore, but I'm using the Restore because I know the changes that have happened in the body, in the course of the past couple of years. So Restore will help the body to go back to a state in which is ready and as close to how it should be as possible. so that if the person wants to take in, the person can, and for the male as well. Okay, it's all about the hormonal balancing and helping the body to be as conducive to give for the male and for the female to receive and implant as well. So I'll recommend the female fertility and the male wellness pack for the couple.
Thank you very much, MI. Thank you. Just to also add the fact that, I mean, I believe that unexplained infertility, a couple with unexplained infertility are really candidates for our products because they obviously have explored and known that, okay, there's nothing. And that, I think they are candidates for, you know, the packs that Emma just suggested. And also, I believe that there's a minute proportion of cases of unexplained infertility that the problem may just be a little infection, undetected infection lurking around somewhere. And those packs contain the cleanser.
Yeah.
So I would be very happy to recommend those, that they should try it for at least 3 months and then, you know, review after that. So thank you very much. Okay, let me take one of the other questions that we had on the list. It says, what can a man who urinates blood use? What can a man who urinates blood use?
All right, let me take that.
Okay, please go ahead.
I would advise the person to see his GP, to see his doctor. We have to find out what exactly is going on, because there are a number of issues that can actually cause someone urinating blood. The list can be trauma, but the other unknown stuff needs to be examined. So some more investigations has to be done so that we would not be treating amiss. So I would recommend more investigations.
Yes, to find out the cause, to determine the cause of the hematuria. Yeah, infection is also one of the causes of urinating blood. There are just so many causes. So the important thing is to first find out, and then, but you know, I believe also that while that is going on, or even after that has been done, our products are natural supplements. I know that the bitters would not go amiss, you know, the person taking bitters, but it would be alongside the investigations to actually find out the cause. Yeah. So thank you. Now I have a question here. It says, can bitters work for polyps? I think she means polyps. She says, I hope I got the spelling well. I think it's polyps. I guess we also need to know where the polyps are here, but over to you.
Yes, like you rightly said, we need to know where the polyps are to be able to tell. But again, the Restore and bitters are very good for anything that, assuming it is the reproductive area. So anything that has to do with that area, either in the male, but majorly in females, we have our Restore and the bitters. And most of the time, medically, treatment for polyps is always surgical.
Surgery,
so,
yeah.
So we have to, still do more investigations, but mostly the treatment is surgical. But like we rightly say, for whatever it is, through the period of treatment and post-treatment, our bitters are very, very good to make sure that everything that it's going haywire within your system is normalized, and also helps you go through the healing process even after surgery.
Okay, I see in here, I think she says it's along the windpipe. So just like Dr. Uche has said, you're muted, Dr. Uche.
No, you're right, ma'am. Go ahead.
Yeah, okay. So,
All
all right.
The person is even adding more comments here, ma'am.
Okay.
Saying that since 2017, he removed some that came out of his nostril, but they grew back. So that means the person has had surgery before. Person has had
Yes,
surgery before.
yeah, because polyps actually don't go away permanently. They
Yeah.
regrow.
Mm.
They always regrow. So we always advise people is either you leave it as it is, as long as it's not causing pain, as long as it's not causing more problems, you leave it. But for some people, due to cosmetics, depending on where it is located, they want it removed. So since it's coming out from the nose here, they cut it, they do the surgery, and after some time it grows back. Yeah.
Well, I think I would say the person should embrace a lifestyle of taking the bitters and cleanser. I would say that. I mean, I know people who, well, this is talking about reproductive anyway. It's helped them reduce drastically growths in their uterus and things like that. So, I mean, the person has had surgery before. Surgery in itself is not, it's not an exciting thing, right? And I can imagine the discomfort the person has been under. The thought again is traumatic in itself. So I'll tell the person to just embrace, have a 30 days, give a break, use again of bitters and cleanser. I think the person would have should be able to get some support and to be able to stem the regrowth.
But just like
Right.
someone that had nasal polyps, he had the first surgery, and after like 3 years, something was back again, and he had the second surgery, and that would be like 4 years ago. So I placed him on the reader bitters, to be using, and up to now, though he still has, every time he's with you, find the way it's breathing, as if there's still something there. But the bitters that have been taken have been of great help to prevent reoccurrence and at least to make him comfortable to, to be able to, how will I put it? Because before the second surgery, he's unable to perform all his daily tasks. But because he was on these bitters going to like 2 years now, there's relief. The growth is reducing and there's no need for surgery. He had been going for checkup regularly. It was every 2 months, then it became 6 months. Now it's now yearly. So everything is under control. So such a person too can go on the bitters, makes it a lifestyle way of taking bitters daily. It goes a long way in preventing the growth and making him to live comfortably and to undertake his daily task.
Thank you very much, Dr. Ogumola. Now I have a question on the chat box. It says, a brother is ill and he is said to be experiencing his immune system fighting itself. His body shakes and he's unwell. He will tell me the name of the disease, but it was described to me by his pastor. So what do we think of that?
That sounds like those autoimmune things, right?
Yes, possible.
There's a solution pack for the immunity. We have an immunity pack.
So I want to assume that the person is on treatment, certainly. If Phoenix Smart 3, I believe that the person is currently undergoing treatment. We have an immunity booster pack that the person can use alongside that. I don't even want to imagine what the person is going through. Yeah, and for the person to still be reaching out, in spite of the fact that is undergoing treatment, I would recommend that the person should start a 90-day plan for it's an autoimmune problem. Yeah, the person is in the UK, so I would recommend the immunity booster pack. We have one for male and we have one for female. Person should just choose one of that and begin a 90-day plan alongside the treatment person is currently on. Those are just my thoughts.
Thank you, Emma. Okay, someone says here, Please, what would you recommend for a child who is autistic, 12 years old?
Autistic.
Hmm.
I'm trying to be careful here because I've seen some children that have been tagged autistic and they are not. But if the child is autistic, most of the time, and the child is 12 years, you can only manage an autistic child. So we just add bitters to what the child is, just to calm the child down, calm his or her nerves down. And then when they wake up, the child is good to go. So I would only go with the bitters, while you also do the every other thing, like giving the child all the warmth that is needed in a family, bonding and all that. That is what they need. And being sure that once the child is autistic, then the child will gradually come out of it. So I believe. But medically, autistic children are just being managed. So we just add the little things here and there, the bitters, and then more show of love within the family units.
Thank you very much, Dr. Uche. If I may add also that one of the postulations of the causes of autism actually is oxidative stress. And so using the bitters, there's a reason behind it. And I believe also that the child should be placed on bitters. Like Dr. Uche said, it's coping strategies, management, but I believe the bitters could help, you know, in supporting the management of the child.
I just wanted to call out something that Dr. Uche said.
Yeah.
About calming the child down. That's big. Yeah, is massive, and it's the same. I would be a bit more. I mean, there's some things you hear, things like Parkinson's, things like seizures, things that are maybe central nervous system, things that are linked to the parts of the body that are not visible. Yeah, the bitters does an amazing work in helping to, for want of a better word, and using regular English, calm the person down. And that's massive, when it comes to anybody recovering from anything. So I would just like to just add a little, just add something to what Dr. Uche already said, to say that I know that the bitters will help in, in enabling every other thing that is being done to work, so that the person has a holistic, experience in recovery. The bitters is amazing. And I think we skipped something by I think it has to do with preaching. I think bitters is like a no-brainer. I just wanted to just group all of that together. I think it just works. It's like a companion for recovery. It just makes everything work. The bitters.
Yes, Mrs. Omojoku's question about this lady who asked about what can help with the son. First of all, I'd like to know how old the son is, because the bitters would definitely help. But if the son is above 15, intermittently adding the cleanser, I believe, would also help, because the cleanser seems to potentiate the action of the bitters. But if the child is a young child, then the bitters would be what would be recommended. Okay, can a 3-year-old autistic use the bitters?
For me, yes. You just reduce the dosage. I have given a testimony here before for my then 3-year-old child. I actually give him I just reduced the dosage and the frequency. So since the child is autistic, you just give the child 2.5 meals 3 times a week, or just for a start. Then if the child tolerates it well, you can increase it at least at night, 2.5 meals every night. And then we reevaluate.
Thank you. Thank you very much. Yeah. Let me see whether I have any more questions in the chat box before we move to the, we have time for a few more questions here. And so it says here, what range of reader products can a person diagnosed with sinusitis use?
That will be reader beaters and the balm. Very, very effective.
The cleanser too can be combined.
Yeah.
To be more effective.
Okay. Yeah, thank you. So the bitters, the balm, and the cleanser. Yeah, I guess the respiratory pack has all those products, and so the person being, because I want to believe it's chronic sinusitis, it's probably been on, so a respiratory solution pack would help. Okay. Now, this question here, it says, a lady has done surgery twice, now developed adhesions. What can she use?
That's a big one.
Mm-hmm.
Well, the female wellness pack can be of help. We have the restore, we have the cleanser, and we have the reader beater. So that will go a long way in helping the lady.
Would anybody else like to comment on that? Thank you, Dr. Gumola.
That's basically it. The Restore, the Wellness Pack, Meal Wellness Pack contains these products, the Restore, the Cleanser, and the Beaters. So we'll advise she uses those. Yeah, that's actually, the adhesions is actually one of the complications of surgery.
Of surgery,
of any surgery, yeah, so.
Yes, it's scar tissue formed, and it will also depend. I mean, if the person uses the Restore and the bitters for a while, and the adhesions are still there, I'm believing that maybe the person is trying to conceive. There's a surgery called adhesiolysis. The gynecologist would be able to decide whether adhesiolysis would help. It depends on the position, it depends on the adhesions, it depends on the extent, it depends on what the adhesions are. I mean, what they are doing inside, to know whether it would help to either remove them, or if it's a fertility case, bypass them. That is IVF. So it would be a matter of, but I believe the person can definitely try the female wellness pack. Thank you very much. So we're gradually coming to the end, even though we still have quite a few questions, but we'll take a couple more before we call it a day. It says, can any of the variants work for a 13-year-old boy who has had seizures from 8 months till now? Can any of the variants work for a 13-year-old boy who has had seizures from 8 months till now?
The age, ma.
13-year-old.
I think they can try the bitters along with the cleanser, because the child is 13. The the child can take it maybe 4 times a week for a start, so that it's not loaded and all. But definitely the bitters and cleanser are worth trying. I mean, somebody who's been battling something from 8 months and is 13, like we said earlier, I mean, I'm sure that will be able to, help to begin some calming work there. And who knows, what I would say is try it and let's see how far that goes in being able to help the person manage the condition. So, yeah.
Thank you very much, Emma. I would also just like to add that, how do I say this? We have a list of, we have a document with the products, which of the reader range can be used in different health conditions. But what I'd like to say is that when in doubt and when there is no contraindication, the bitters is one to go for, at least to start with that. Even without, I mean, once there's nothing that contraindicates the usage of bitters, the bitters is number one. And then from there, we can now add the variants if necessary. Yes, the A to Z of diseases document. Thank you very much, Emma. So I think we will take this last question here. It says, what range of our products can you prescribe for someone who, though an ulcer patient, is suffering partial stroke, like her right hand shakes violently?
Okay, for this person, we have a hypertension lifestyle pack. That is definitely the go-to for this person. But when the person wants to use the bitters, we encourage that the person dilutes in half a glass of water before use. And then we've had, I mean, amazing, I don't know what's happened lately, but I've had amazing testimonies on ulcer in the past about 2 weeks. I mean, it's like they all sent them in my direction, So, I mean, I've had quite a lot of that. So, we are really the person is going to be getting 2 for the price of 1. So when person goes for the hypertension lifestyle pack, just ensure that, when it's time to take the bitters, dilute it in half a glass of water and then takes a glass of water after taking that. And then follow the dosage guide for the hypertension lifestyle pack. It has a balm as well to be able to help massage the area and, all of that. Yeah.
Thank you. Thank you very much, Emma. I also believe that, I mean, for a person who has suffered a stroke, actually, I am not sure there's a diagnosis called partial stroke, but perhaps it is partial paralysis as a result of the stroke. But yeah, but somebody who has suffered a stroke would have seen their doctor, would be under medical care. So whatever they're taking would be in addition to what is being recommended by their medical practitioner, the medical team. So I think we have, I don't think there are any more questions from.
There's a question in the comments.
Oh.
The second to the last one.
Oh, okay. I must have missed that. Just a minute. Oh, sorry about that. What can an old man of 84 years use who cannot control his urine?
Well, talking about the solution pack, we have the one for the senior citizen. We have the one for the female, and we have the one for the male. So the 84-year-old man can actually make use of the senior citizen pack. And that will be of a great help for him to, there might be a lot of things that causes his, excessive urination. And I think such a person would have been to the hospital, a lot of tests would have been done. And there's even the probability drugs on some drugs that he takes daily. So the senior citizen pack will be of great help to take along with his medication. And at least it will still prolong his life. And there's need for good food, to go along with it. Let's check the time he eats in the evening. before going to bed. Also, that one is also important. But the senior citizen pack will be of great help in this case.
Thank you very much, Dr. Ogumola. Well, I think this is all we have time for today, but I want to believe that our panelists have done justice to all the questions that have been asked today. I mean, as we ask the questions, they're curated, so you can always be sure that at some point you will get responses to your questions. We have the question and answer session on the 3rd Wednesday of every month, and it's been great having you all here. I want to believe that even for those of us who didn't ask questions, the answers to these questions have provided, you know, a rich knowledge for all of us. Thank you, Dr. Ogumola. Thank you, Emma. Thank you, Dr. Uche. It's been great having you. It's been a privilege being here, and I thank everyone for being here. So let's have a wonderful night's rest and a great day tomorrow. Good night, everyone.
Thank you.
God bless.
Everyone, thank you.
Good night.
Good night. Dr. Uche, it's good afternoon where you are, I'm sure.
Yes.
Dr. Ogumola, well done, ma. Dr. Aino, well done, everyone. Have a good evening. Yes.
Good.
Yes, ma'am.
Okay.